When thinking about dementia generally, a common way in which people are diagnosed as having dementia or not is via the significant presence of at least two of the following issues, right? So the first, and this is in order of importance, okay? So as you may have guessed, memory loss is a primary concern. Up there is number one. One of the most critical criteria for diagnosing whether someone has dementia or not. We know that we see up to a 40% shrinkage in the parts of the brain associated with memory when we've got a hearing loss that we've done nothing about, and the more effort that it takes to put together conversation, the less of that conversation is going to be remembered. Just as a brief illustration, our short-term memory can generally hold around 7 bits of information at any one time. When you get to my age, you kind of remember back around about 30 years ago when phone numbers, the home phone number were about 7 digits. You could remember it pretty easily. How many home phone numbers how many mobile numbers can you remember, right? You know, so once we get past 7, it becomes like quite difficult. So what's occurring when we've got a hearing loss, we're not hearing all of the word just through our auditory system, and we're having to call on our vision to help put those bits together, and sometimes that's not enough, and we're going to think about the context of the conversation, and we're mid conversation trying to put together what this person's saying. It doesn't take long for our short-term memory just to fill up, right? And the harder that's working, just trying to put the conversation together, there's a downstream effect in encoding for long-term memory, right? So very clear links between our ability to hear well and our memory, right? Communication difficulties, so clearly related to our ability to hear well. And one of the primary concerns of having communication deficits relates to the devastating effects of social isolation, right? So social isolation during the COVID-19 period, you'd be quite aware that there was quite a light shone on that and the devastating impacts. We know that the socially isolated and the lonely don't live as long. They're more likely to be depressed, and they have measurably smaller brains. Quite a concern, and there's acres of literature that points to the devastating effects of social isolation and links between hearing loss, right? So it's really common. So, and I'll just talk about that a little bit. What the number one complaint that we get in the clinic is hearing and background noise in groups, right? So when the experience of that for a hearing impaired person that hasn't treated a hearing loss is that social situations start to become less enjoyable. The common reports are that they start to feel left out of the conversation, not part of it, right? Not like completely involved. It can be embarrassing if you're asked a question that you thought was something completely different, laughed at something that wasn't actually a joke, or didn't laugh at something that was actually genuinely funny. So a very common trend, and for decades there's been clear scientific evidence for this. People with hearing loss tend to socially withdraw, right? So communication difficulties are important for the classification for dementia. Also, there's far-reaching consequences for people with hearing loss, particularly around on the social front, right? Attention deficits. So, what they're referring to here are the several cognitive functions that relate to our ability to pay attention. Selective attention, for instance. Also relates to our ability to I guess, be engaged in a specific activity and also have reserves to maintain others. An example that I'll give you is there's a clear link between untreated hearing loss and your risk of having a fall, right? So we know that, and there's several papers on this. One example is in a study of 20,000 men aged 60 with a mild hearing loss, so only about a 25% hearing loss. They were 3 times more likely to have been admitted to hospital as a result of having a fall relative to their normal hearing peers. So it's quite well established that a mild hearing loss, there's a 3 times more likely falls risk, and for every 10% of hearing loss, that risk actually doubles, right? So why are people with hearing loss more likely to have a fall? Well, there's 2 main reasons. One is the less aware you are of your environment, the less well you're going to be able to respond to it. So if you miss a step, or you tread on a twig or a toy, or you're out and about walking and there's bikes whizzing by, things like that, the less aware you are of your environment, the less able you're going to be able to respond to it. Okay. But the main reason the researchers put this increased falls risk down to, they put it down to attentional deficits, because the more effort that you're putting into following conversation, or that your hearing system's on high alert for whatever it can get to compensate for a hearing loss, it starts to take away from other resources, including balance and steadiness, right? It's really difficult to treat. Cognitive decline, dementia, Alzheimer's, there's no medications that are particularly effective, despite the billions of dollars that are being put into it. Hearing loss, on the other hand, is exceptionally easy to treat. Understanding dementia prevention is actually kind of a really hot topic at the moment, because we know that with our aging population that it's really on the rise, as with many other chronic health issues that come with aging. It's projected that by the end of this decade, there'll be more people in the world with dementia than there is the population of Germany. So it is growing. So it's of supreme interest for us to understand, well, what can actually be done about it. And there was a major article that was put together. It's what we call a meta-analysis, where the researchers brought together information from the best medical journals in the world together to look at what does the literature tell us about dementia prevention. So what can we actually do about it? This was published in the Lancet journal, which the Lancet journal, if you're not familiar, is particularly in relation to the neurosciences, is the most influential medical journal on the planet. And they were looking at, well, what does the best research tell us about dementia prevention? And they came to the conclusion that 35%, based on what the science tells us, 35% of cases of dementia can actually be prevented. And what, as a general statement, we're not talking medication, because that doesn't really exist in a meaningful, or at least in this study, it wasn't really pointed out as being a significant intervention. What the researchers are really looking at are long-term lifestyle intervention, right? And they came to the conclusion that hearing loss is the most significant thing. So hearing loss, the number one modifiable risk factor for the prevention of dementia. Modifiable meaning that there's something that you can do about it, because hearing loss, it's really common and it's highly treatable. So just looking through the study, basically they came to the conclusion that different interventions at different life stages can improve your chance at avoiding these diseases of the brain. 8%, so of the 35%, 8% of that was down to, they put down to having less education in early life. So early life they define as being 40 years or less. And it's assumed that the better educated you are, the more connections are formed in your brains, the more buffer you have against these diseases later in life. However, I should point out is that separate to this, there's very good evidence that lifelong learning is one of the best things you can do as an adult to help reduce your dementia risk, right? So so I applaud you for coming along to a session like this where hopefully you will learn something new, and hopefully you continue to go to other such sessions like this. On that particular topic, I'm going to just talk a little bit about Alzheimer's disease, right? So Alzheimer's is the most common form of dementia, and I was quite horrified. The more I learn about these diseases of the brain, I was quite horrified to learn that Alzheimer's can be incubating in your brain for a period of 25 to 30 years before you even start to show symptoms, right? So what's occurring is that we get these plaques, we call them beta amyloid plaques, that kind of gum up these connections in our brain. That takes quite a long time. We also get some inflammation and some other things going on between these existing connections in our brains, right? So when we're talking about neuroplasticity, if you didn't already know, we've got the ability to form new or fresh connections in our brains, right? So in doing so as adults, the more new things you're learning, the more new experiences you're having, the more you're getting out of your comfort zone, potentially traveling, going to new places, having new experiences, what you're actually doing is creating fresh connections in your brains. Lifelong learning is just like one of those things. You're creating fresh connections in your brains, right? So a disease like Alzheimer's, if that is actually, if you're unfortunate enough for that to be kind of incubating there, the fact that you're building these new connections just helps give you somewhat of a buffer against the onset and the severity of that type of thing. Okay, so lifelong learning, really, really important. When we get to midlife, so they define midlife as being between the age of 40 and 70. This is where hearing loss comes up. Hearing loss, of the 35%, 9% of that was specifically down to treating hearing loss in midlife, right? Because we know hearing loss is really, really common. We know that the sooner we address it, the better the outcome is over the long term, and it's highly treatable. So it was the highest effect size in this whole study. Hypertension is there, and 2%, obesity is there at 1%. When we get to late life, you could imagine, you could probably predict that smoking would show up there somewhere. So smoking, 5% of the effect size is down to smoking. The next three are rather interesting because each of these relate specifically to our ability to hear well. Depression is there at 4%, physical inactivity 3%, social isolation 2%. We've addressed social isolation to some degree. Acres of research pointing to a trend to social isolation when there's hearing loss. Acres of research also that people with untreated hearing loss are more likely to be depressed, and both depression and social isolation tend to lead to less physical activity. The more you getting out and about, the less physically active you tend to be. So, if we combine the effects of the direct effects of hearing loss and even some of the indirect ones, around half, slightly more than half of the effect size in this whole study of the world's best research in dementia prevention, hearing loss it comes up as really the most important thing that we really should be looking at. Particularly when considering cognitive decline, it's one of the most straightforward and rapid ways of addressing it. I tend to find that my patients, they're more concerned about their brain health, their cognitive health, than they are about the nuisance of hearing loss. There's now acres of research that points to the detrimental impact that untreated hearing loss has on our cognitive abilities. So short-term memory, reaction time, processing speed, general executive function, the kind of abilities that we have to help navigate day-to-day life. Overwhelming, repeated studies, large-scale studies, all pointing to the detrimental impact that untreated hearing loss has on cognitive health. When that link is explained in a way that my patients and my audiences can understand, then it becomes a different kind of a motivation, because quite often they've started to notice that they're becoming more forgetful. They're starting to notice that things taken more. It's more effort, right? Particularly following conversation in challenging situations, it's just harder. So when that link is made between that nuisance of hearing loss and that, this may relate to the fact life's becoming a little bit more difficult now, then it becomes a different kind of decision. And I tend to find too that when those links are well understood, it tends to motivate people to actually keep their devices in, right? If there's one outtake when I do my live seminars, the most common kind of feedback that I get, because a lot of people that come along do actually have hearing devices, the most common feedback that I get is like, well, now I'm actually wearing them, right? There's cases where, in a 2-hour live seminar that I'll do, we have a break in the middle, and I've seen people run out to their car, get their hearing aids, come in and wear them, and they've been consistent wearers since, But to actually take that step and treat the hearing loss, to get in the habit of wearing them all day, it does require a degree of motivation, and particularly those the benefits on cognition. What the science is telling us is that starts to happen quite quickly, right? So a number of my patients, I'll do a follow-up after about 6 weeks or so, and they tell me they're less exhausted at the end of the day. They find that they're becoming gradually less forgetful, and the science supports this. So what the science is telling us is that treating hearing loss has a clear protective role on at a minimum, a clear protective role on our cognitive abilities. The science is also telling us, if we're thinking about dementia risk, major study done in 2011 really sparked research interest into hearing loss and cognition, and it was a general study on aging, and it was looking at what happens to people generally between the ages of 60 and 72, what's happening with the aging process generally, with aspects that are known to be associated with aging. So this study, 2011 study from Johns Hopkins University, looked at what happens over a 12-year period. There was 600 people in this study, aged around 60. They came in every year to the university for 2 to 3 days of intensive testing every year over a 12-year period. And the researchers were looking at male pattern baldness. They were looking at the kind of fungus that grows as you get older. Hearing loss was just a very small part of what they were looking at. So none of these 600 people at the beginning of the study had dementia. That was one part of the criteria. At the end of the study, the most astounding finding that the researchers came across was the very clear links between untreated hearing loss and dementia. People with a mild hearing loss, which is about a 25% hearing loss. When I graduated university 20 years ago, we didn't really care so much about mild hearing loss. We are most concerned about mild hearing loss in this day and age. Those people were twice as likely to have developed dementia during the study period relative to their normal hearing peers. Those with a moderate hearing loss, which is 25 to 40% hearing loss, most of my patients have a moderate hearing loss. Those people were 3 times more likely to have developed dementia relative to their normal hearing peers. Those people that had a severe hearing loss, which is around 50% or more hearing loss, those people were 5 times more likely to have developed dementia during the study period relative to their normal hearing peers. Quite astounding. It was the most remarkable statistic that came out of that whole body of research, and this was a major study on aging.